Hi, my name is Cindy Redeman, and I am founder of Living Grand with Diabetes. Living Grand with Diabetes is an organization that is focused on diabetes, of course, and you can find us on Facebook and on my website, livinggrandwithdiabetes.org. We are here today with Dr. Wes Sade. I want to thank you for coming out and sharing your expertise and taking the time with us. You've been such a great inspiration in my life and have helped me along the way in so many ways you don't even probably understand what a blessing you've been to me. And I know that you will be to others watching this.
Thank you. I'll do my best.
Okay. Would you start by just telling us a little bit about yourself?
Absolutely. I'm a family physician. I'm board certified. And I practice in Crowley, Texas. We have 2 clinics called Total Care, and I have been a physician 10 years this year. I also specialize in weight loss and also endoscopy. Other than being a doctor, I'm passionate about something called servant leadership that probably a lot of your viewers are familiar with. I like to blog and do a podcast on that at aspiretolead.net. But my primary job is being a physician, being a doctor, and I love being a doctor.
Oh, you are a good one.
Thank you. Thank you so much.
Well, then we're going to just go ahead and get into it, and I'm going to ask you a question. How do I control my sugar levels when exercising? I know for myself, exercising is very important, and I've had to learn how to control it. But can you give us some advice on how to do that? And also, if you're wheelchair bound, what are maybe some exercises a person can do that can still stay so they can stay fit?
Right. Excellent question. And this is a common question that I see in my practice. But Cindy, if I may, before we talk about good control during exercise, we have to talk about just briefly about good control without exercise.
Right. Okay.
You know, if you're trying to exercise and your blood sugar is already very erratic, then it's really like a hopeless situation. Mm-hmm. So to have good control without exercise, let's take exercise out for a minute. The summary of it: you want to eat right, and you do that by eating at the same time 3 meals a day with 3 snacks in between. So you're eating 6 times a day. And more or less, you're eating 50 grams of carbs on each meal and 15 grams of carbs on the snacks.
Okay, what do you say to the people, though, that say 6 times a day, then I'm going to even gain more weight?
Right. Obviously, you're not eating a whole lot. So 50 grams of carbs is not a whole lot of food, right? So you can still control your calorie intake, but control your grams of carbs.
Okay.
Absolutely. So if you have the food portion down and you're taking your medications, let's say you're on metformin or insulin or whatever it is, you're eating right, and you're eating 6 times a day, so your blood sugar is not going up and down, right? You're taking your medicine, and now you're getting ready to exercise. You're already coming from a good platform. Now what you gotta do is this. My advice is, first, you don't want to jump into it and do a whole lot at the beginning. Being a new diabetic, or if you're trying to change, it's really a discovery journey. So what I would do is I would aim to start with about 15 minutes to 30 minutes, and you want to see how you do. And you want to start by checking your blood sugar before and check it in between, say after 15 minutes, and then after 30 minutes, and then see how you do.
Okay.
The general rule of thumb is, if you're starting your exercise and your blood sugar is under 110 to 120, you want to eat about 15 grams of carbs.
Wow. Okay.
Okay. And if you're gonna do, say, 15 to 30 minutes of exercise, it all depends. Is it strenuous exercise, or is it doing Tai Chi, where you're just moving and not doing much? So I would start with doing mild to moderate amount of exercise.
Okay, like I'm sorry to interrupt, but
Please.
What I've been stressing to people on Facebook is how I started was just walking.
Great.
I just started walking. I started with a quarter of a mile a day.
Great.
And when I could do that comfortably and breathe good through it, I went to a half a mile and so on. So would that be a good starting point to?
Yes,
to
Absolutely. That's great. Well, let me ask you, did you start by checking your blood sugar before
do before
and after?
and after.
Okay.
Yes.
And say with 15 to 30 minutes of walking, does that usually, in your case, affect your blood sugar a whole lot?
No, it doesn't affect mine, but I do have my blood sugar under control.
Great.
Very tight rein on my blood sugar.
Wonderful.
So, yeah.
I think you did it just right.
Okay.
You know, start with walking or something similar, and do check it before and after. If you're under 100, 110, you know, go ahead and eat about 10 to 15 grams of carbs, and then see what you do.
Okay.
The key thing, Cindy, is everyone is different. You know, your body is different from mine. Your diabetes is different from mine. The medicine is different. So it's really going to have to be tailor-made for each person. The key is we don't want to overdo it at the beginning and drop our blood sugar, and hopefully, you know, we don't want to pass out or do anything like that.
Right. Okay.
Right.
Right. Okay. Thank you so much. I've had
Sure.
so many people ask me that. And what about in a wheelchair? What
Right.
can wheelchair-bound diabetics do to be able to stay fit and
Right.
healthy and you know, and still feel good about themselves?
Right, absolutely. Well, you know, being wheelchair bound is also a range. It could be a range of you know, functionality. Some people really cannot move much. Some people may be older and frail, or some people may be temporarily in a wheelchair. I was recently in Iowa for a bike ride. I think
Yes.
you mentioned something on Facebook about that, but we we rode every day for 7 days, and there were about 10,000 riders. It's called the RAGBRAI. There were a few people that were wheelchair bound. They were doing arm cycling.
Oh.
Right. So, you know, being in a wheelchair, it can range from being a professional, like Olympic para-athlete, or doing these type of, you know, 7-day bike ride, or it could be someone who's really more frail and cannot do much. So it really depends where you're at. But regardless, being active, it is so important. So what can you do? You know, you could do several things. Number one, you could try to do chair aerobics.
Okay.
So chair aerobics is when you basically primarily using your arms to increase your heart rate.
Okay.
So there are a lot of videos out there, or a lot of resources, but I would look for chair aerobics. Aerobics is really good to get your heart going, so it's good for your heart. It's good for diabetes and whatnot. One thing I would recommend for anyone on a wheelchair is to talk to either an occupational therapist, physical therapist, or really best a kinesiologist. A kinesiologist is a person who specializes in sports medicine.
Oh, okay.
So I would talk to them and say, look, you know, I want to be active. What can I do? Other than aerobic type exercises with the arms, you could think about water aerobics. Yeah.
Good idea. Right.
Obviously, you have to do it in a safe environment, you know, because you know, it all depends how much use of your legs you have and whatnot. So water aerobics is really, really great. So that would be another option. A third option is obviously some stretching exercises that you could again find online, or different sources, or strength training. So if you don't have any use of your legs, obviously the legs won't be involved in that. It will just be arms. But a lot of people that are wheelchair bound, they can use their legs, they're just not strong enough to walk.
Right.
Right. So, you know, without going a lot into the details of specific exercises, plus that's not my specialty.
Right.
You know, those are the general criteria. And, you know, and one last thing I'd like to say, Cindy, is it is very easy to lose hope, right?
Right.
And this is something you've always talked to me about.
Right.
You know,
Right.
you said, I want to do this Living Grand with Diabetes, and I admire you so much, you know.
Thank
it's
you.
to give people hope. But, you know, when people are in a wheelchair, they have an issue with hope. Anybody of us would, more than others. So exercise is going to be very, very important to keep people feeling good, you know, and feeling just that they can keep going.
Right.
So I'm very glad you asked that question.
Thank you. I'm glad that you shared what you did, only because I have talked about this several times on my Facebook page, and I've had a lot of people ask this question and what they can do.
Right.
And so thank you so much for that.
Absolutely, absolutely.
The next question that we have is, since being diagnosed with diabetes, I myself struggle with depression at times, and I'm sure many of you do. Why is that? Why do we struggle? Why does a diabetic struggle with depression so often? And it's not continual. I'll have it for maybe a day, or I might have it for a month. But what causes that in a person to have that kind of depression when they're a diabetic?
Absolutely. You're absolutely right. Diabetics have a little bit more frequency and incidence of depression. I'm not aware of any scientific explanation of high blood sugar causing something, for example, in the brain to cause that, but we definitely see higher depression. And I think it's because of the stress and of the rigors of being a diabetic. You know, as you know, when you're a diabetic, especially if you want to do a good job, you have to change your lifestyle, right?
Right.
You cannot eat what others eat. You cannot sometimes go where others go because you have to do certain things, check your blood sugar or eat. You know, you have to let go of certain foods that you like. Sometimes you may have feelings of, you know what, I am not like everybody else.
Right.
You may feel like people don't understand me or people are not supporting me. So I believe the major cause for depression is all of these small, sometimes big stressors that add up. And as you know, Cindy, any stressors in life, in my practice, I see people coming in, for example, let's say they just went through a divorce or a loved one died or, having trouble at work. And basically life can be hard.
That's true.
And being a diabetic is hard. So I believe depression is just because of that. The good news is, I think if we have a plan and you help people have hope and have a plan, I think that will become better and better. If we're always struggling, we don't know how to eat and we don't know what to take and our blood sugar is dropping and we can't exercise, you know, it's like a problem that can't be solved.
Right.
And that's really going to contribute to. So I think what you're doing and trying to get people to have a systematic plan on how can we make this easy and easier, it's really going to help.
Right. I think for me, what's helped too is sharing with those I'm close with that I have diabetes and give them the signs of that depression,
Right.
and so that they're aware of it. And they know how to help me get past that depression that way.
Absolutely.
So I kind of would recommend that you would, make sure you share it with those you're close with, those that you feel comfortable with.
Right on.
And it helps me.
Right.
So,
Right.
It's just another little point maybe.
Absolutely. Definitely agree with that.
I have a couple of friends that are on an insulin pump. And I have found with the couple that I know that they tend to just up the dosage so they can eat whatever they want. How can I encourage them to eat better, healthier, and not just use that insulin pump as just let's increase the dosage so I can eat unhealthy?
Right.
What would be some good ways or any advice you might have on how I can talk to them without nagging them to eat correctly?
Right.
Because one thing as a diabetic is we don't like to be nagged. We know what's right and what's wrong.
Right.
So.
Right. Well, this touches on how do you give advice to people and things like that. And in my office a lot of times I see couples come in where one of the spouses is not doing what they're supposed to and the other one is nagging them, and so I deal with that quite a bit. Plus for me as a doctor, in a way I'm in the business of giving advice, and I don't want to seem like I'm a nagger because I want to help people.
Right.
And whatnot, so So the general approach, I believe, to helping people, giving them advice is you have to kind of respect them, and at the end of the day, it's their decision, not yours. So when a couple, for example, comes in and one is nagging the other, I say, you know what, we don't want to force it upon anybody.
Right.
We want to explain and we want to support, but we don't want to nag. And if that person decides not to follow through, it's their decision and it's their life.
True.
Now the paradox in that, Cindy, is when that person hears that, they're like, okay, it's almost like a sense of freedom, and they start listening more.
Oh, very good.
It's kind of like reverse psychology almost.
Right.
But I mean it. If somebody, for example, some people come in and they want to smoke and they have lung cancer and whatnot, and I'll say, sir, I'm going to love you and take care of you whether you stop or not.
Right.
It's your life. If you decide to smoke and die in 6 months, I'm going to respect you and I'm going to love you. I'm going to take care of you either way. But here's my advice to you.
Mm-hmm.
People seem to respond to that a little bit better than what's wrong with you.
Right. Why are you doing this?
That's right.
You know better.
That's right. That's right.
Right.
Because none of us want to feel, talk to like a little child, So I would start there, meaning approach that person from a sense of, here are my thoughts on it, but it's your decision,
Mm-hmm.
right? So the next step comes to, what are the facts?
Mm-hmm.
Because they may tell you, look, I'm gonna take more insulin and I'll be fine.
Right.
Right? So what are the facts? Whether you take more insulin in a pump or whether you can inject yourself
Right.
too. There's
Yeah.
short-acting
Right,
stuff you
that's
could
true.
take, right? What happens is even though you're doing it just right, your blood sugar is still gonna go up and you're still at risk of going down. So the peaks and troughs, I don't care how careful you are,
Right.
you cannot replace your pancreas. And you cannot just have it just right.
Mm-hmm.
So even if you're increasing your insulin, for about 10-20 minutes, your blood sugar is gonna go a little bit haywire.
Right.
And over the long run, that's not good. That's not good for your eyes, for your blood vessels, for the risk of heart attacks. So even though you're okay and you're not gonna end up in the hospital,
Mm-hmm.
your blood sugar is gonna go up and down in such a way that it's just not good.
Right.
Ideally, you want to have your blood sugar, be as level as you can
Mm-hmm.
throughout the day, and you do that by eating right. And there's no substitute for that, regardless.
Right. Right.
Right.
Which I have found.
That's
you
right.
have to eat
That's
right.
right.
So
Absolutely.
to be
That's
able
right.
to stay healthy.
Right.
And talking about being healthy, if I do become sick, do I continue taking my medicine? Do I stop taking it? Because I know when I have been sick, my blood sugar seems to be a little bit higher.
Absolutely.
So do I still take the same dosage, or how do I know, or
Right.
on what I should do when I'm sick as far as my medication goes?
Right. Excellent question. Also that kind of takes us back to what is our baseline. For example, if you are a controlled diabetic, it's going to be much easier to do anything because your baseline, you can predict how you behave, your blood sugar behaves, and then when you get sick, you can kind of monitor it and then go from there. Let me take some examples.
Okay.
Let's say you have a GI bug and you literally cannot eat anything for 24 hours, okay? And let's say that you are on insulin only, right?
Okay.
I would recommend in those situations that you would stop taking your long-acting insulin and you would check your blood sugar 4 times a day and see how your blood sugar is doing. And operate off of a sliding scale. So if your blood sugar is say between 150 to 200, and your doctor could give you that, between 150 to 200, I would take a short-acting insulin versus a long-acting insulin, right?
Okay.
Yeah. So if you're taking oral medications, all depends. If you cannot eat at all, let's take that as an example. You cannot eat at all for 24 hours. I would also probably either cut down your medicine or just don't take any. Because remember, we want to err on a little bit high than a little bit low.
Right.
Right?
Right.
So if your blood sugar if it goes up temporarily to 200, it's not good, but it's better than
Right.
if it went down to 50 and you pass out.
Right.
So let's say you're a new diabetic and you're just diagnosed with, let's say, a GI bug and you're not eating. This is the first time this ever happens. I would not take any medicine and see how your body reacts to it. Because again, your body is different from mine. When you're sick, it's different from when I'm sick, right?
Right.
So the name of the game is vigilance. So check your blood sugar at least 4 times a day when you're sick, or 5 times a day. And then I would err on the side of taking less than taking more.
Okay.
And then see how you behave.
Okay.
Yeah. So that would be a general, a general advice on it. But it can be complicated, definitely.
Right,
All right.
right. I know in different circumstances, depending on how I feel, and when I'm sick, my blood sugar does fluctuate a little.
Right.
However, because I am pretty controlled with my diabetes, being sick doesn't affect it a whole lot.
Right.
So I guess that would be the key. Get
Right.
your diabetes under control so that when
Absolutely.
you are sick,
Right.
and staying hydrated when I'm sick.
Oh, yes.
That's
Right.
a big thing is trying
Absolutely.
because when you're sick you don't even feel like drinking something sometimes.
That's true.
But you have to make yourself just like you have to take your
true.
medicine. You have to do it.
Absolutely. Absolutely.
So, another thing that I struggle with, and you know this, is my feet and feeling like they are on fire all the time. The bed sheets touching my feet. It feels like it's painful, but yet they're numb.
Right.
Can you explain to me what that would be and why it
Yes.
happens?
Absolutely. So as you know, Cindy, the nerves that come out from our brain, a lot of it go through our spine, and then from the spine, it goes through our legs.
Okay.
There are two general types of nerves. There's the motor nerves and the sensory nerves.
Okay.
If I'm trying to move my hand, it's my brain using the motor nerves to the muscles that will
Okay.
literally kind of fire and then will just have me move. And then the other kind of nerves are called the sensory nerves. The sensory nerves will help us feel and sense. There's different kinds of senses, pain, heat and cold. There's light touch. There's different kinds of nerves, but the nerve that makes us feel, they're the same types. They're called the sensory nerves. They're in the legs, they're in the arms, they're everywhere. So these feelings that you're describing are affecting the sensory nerves. When these nerves, and also of note, the nerves is just a cell, it's a living body cell, and it's a
Okay.
very long cell. It's very peculiar. The body, the nucleus of the cell, could be either in your brain or it could be in your spine, and it has a very long, very long part that goes
Wow.
to the tip of your feet. Right.
Wow.
And it's one cell, and that cell has to be nourished, right, like any other cell. If that cell, that nerve cell, along its path, it's not nourished just right, it's going to be sick, for lack of a better word. And the feeling that's produced is gonna feel abnormal. We call it paresthesia. Paresthesia is basically abnormal sensations. Instead of feeling the right sensation of pain and cold and feet and heat and all of that, you're gonna feel those things you're describing. We call them paresthesia, which includes tingling. It includes numbness,
Right.
And it can include, hypersensation. So you're feeling, if you touch the sheet, it's just extremely sensitive,
Right.
It can also include pain, and different stuff. So when a person comes in and having these sorts of things, we are focusing at that point as to what's causing that, and and addressing and see what can be done about it. But the question of why you feel that is because that nerve cell is not getting enough nourishment, because as you know, with diabetics there's not a lot of good circulation if your blood sugar is not controlled.
Okay. So would you say then keeping your circulation going and working on your circulation, meaning exercising,
Right.
things like that would that help
Right.
then in the pain and the nerve endings and stuff in your feet?
Right, that's good. So the way we would address that is, number one, most important always is controlling the blood sugar.
Okay.
And most important way to do that is controlling your diet. So when somebody comes in and says, Doc, I'm having pain, and the expectation is give me some medicine,
Right.
that's not the right approach. There are medicines that help with these kind of pains, but the number one thing is we need to get diabetes controlled, right? That's the number one order of business. So, and we want to control diabetes before these symptoms start, because when these symptoms start, sometimes it's a little bit too late.
Right.
Right. So, but even if these symptoms have started, nerves are very good at healing and regenerating.
Oh.
So regardless, if you're a diabetic watching us and you don't have these symptoms yet, if you're not careful, they will happen, right?
Mhm.
So we want to control diabetes ASAP, right?
Right.
Control that blood sugar. Number two, anything that helps circulation is going to help.
Mm-hmm.
For example, if you have swelling in your feet, if you are overweight, you're gonna have more what we call dependent edema, which means the lower part of your body, which is dependent on gravity,
Right.
is gonna have a little bit of edema, which is swelling. Sometimes you can't even detect it. Or a little bit more that you can detect, and that also can cause less circulation, because the more you have swelling, there's more space, so to speak, for blood to flow. So if you have swelling, we want to encourage people to raise their feet. Definitely exercise moves the muscles, and that promotes movement of blood flow. So movement of blood flow is going to also increase bringing nutrients to those nerves.
Right.
So I would say blood sugar, weight control, which are things we know we need to do anyway.
Right.
Exercise, elevating the feet, eating less salt and sodium. Those are things to prevent it. And of course, you could take some medication, but we really want to stress, we want that as a last resort.
Right. Seems like the theme we have going here is diet, not the dieting, but
Right.
changing your diet and
Absolutely.
eating healthy seems to be the theme on helping and
That's right.
everything we've talked about pretty much.
That's absolutely
So
right. That's right.
what are some of the health issues that are caused by uncontrolled diabetes? I know we talked about the feet. What else is there that I know there's several? So if you could maybe touch and explain a little bit about those.
Absolutely. Just to list them real quick, the major ones. Heart disease is increased, so people have more heart attacks, and of course the effects from that. Strokes, eye disease, kidney disease, and higher infections. If I were to pick the top five, I would say that.
Okay.
Most of these, or all of these, I think, Cindy, stem from a higher blockage of blood vessels. So the reason we have higher infections is because the circulation is not as good, and there's not a lot of healing, right? That's why people sometimes unfortunately lose their feet, because they get a wound and they don't know that it's there, right? And that's why people need to check their feet every day. But what is also bad is when we get to it and see the wound and we try to give them medicine, they just don't heal as well. So now you have an infection that you cannot treat, and that's spreading. And if it's bad enough, the only option would be is to cut that limb off or that toe off or whatnot. And we probably both know people that have had that.
Right.
It's very sad.
Right.
But the other, the heart disease, the strokes, the kidney disease, the eye disease are things that when you're a diabetic, we have to be a little bit more aggressive. For example, cholesterol needs to be a little bit lower in people with diabetes than people without diabetes.
Okay.
Right? We have to go to the eye doctor once a year to make sure that we're not getting damaged. We have to check your kidneys with blood work or with urine testing or both to make sure if it starts happening to catch it early and treat it.
Okay.
Absolutely.
Okay. Just for those of you, when it comes to checking your feet, if it's hard for you to do, what I do is my husband checks my feet for me almost daily. Somebody that if you don't have a spouse, but somebody, a parent, a child, somebody to check your feet every day, I think is really important because I don't want to lose my feet. So I do it. But now let me ask you, if I keep my blood sugar under control, does that stop the chance of that happening, or does it just minimize the chance of that happening?
Good question. One of my professors in medical school, I remember him to this day. He always told his patients, and I tell my patients, basically what he said is, if you control your blood sugar, you're going to live a normal life. you won't have any problems, you won't have any issues. It's almost as if you don't have diabetes, other than you have to take care of your diabetes. Right. So if you've been a diabetic for 10 years and you've ignored the symptoms and whatnot, well, basically there's not much to do there. That period of time where you just didn't know the damage has happened. But once you find out you're diabetic, from there on out for the rest of your life, if your blood sugar is controlled well, you really should not have any problems. Now, having said that, in reality, most people are unable to control it all the time. I mean, that's our goal, and that's what we want to aim for. And to the degree that you control it well, you won't have any problems. So, for all intensive purposes, if you're able to control it, and if you have adjusted your life and your priorities to control it well, you are going to live an almost normal life compared to a non-diabetic.
Okay, that's good to know.
Right.
I think that when we're diagnosed as diabetics, I know what words came out of your mouth that I'm a diabetic. First thing I did was I cried.
Right.
And because to me, I thought it was a death sentence.
Right.
And the education of knowing that that's not the case, and it doesn't have to be, is liberating.
Right.
And so thank you for that.
My pleasure.
I'm excited to know that it isn't a death sentence, you know?
That's right.
One of the things I wanted to talk to you about is just in a daily life as a diabetic. I myself keep my diabetes under control. But when you're going on vacation, you're going to visit family, you're gonna, the holidays are coming up soon. How can we stay in control when there's all this food around? There's all these desserts around. Right. Do you have any tips that would help us as diabetics to be able to keep in control?
Sure.
And not let ourselves get our blood sugar out of control?
Right. That's a great question. Cindy, I think the key to success as a diabetic is you have to get to a point where you say, I am not like everyone else, and I'm okay with it. We're gonna have to adjust our priorities and our plans, and that's gonna be part of our new normal. So a lot of diabetics come to my office, and I can sense that there's a bit of a denial, It's like, I know I'm a diabetic, but I want to behave like I'm not a diabetic. That won't work. When you're diabetic, you have to educate yourself of what needs to happen, and expectations need to shift. Just like, when we are over 30 or over 40, we cannot go for a jog like when we were 15. We adjust our expectation. We just cannot do it because our knees hurt, There's got to be a similar shift when you're diabetic. When you're diabetic, if you control yourself, yes, you're going to be normal, like we just said. However, you are not like everyone else anymore. You cannot be a 15 or 20-year-old, or whenever you were a non-diabetic and you would go to a sweet shop and eat the cakes and all of that. That part is gone. And I know it's sad, but we have to get to a point to say that part of our life is gone. Now this is a new chapter, and we're okay with it. We have to accept it, right?
Right.
So that's step number one. So now that we've accepted it and says, okay, well, what do I need to do? I'm fine. I'm not like, I'm not gonna go binge and get a big tub of Ben and Jerry and eat it. I'm okay with that. But what's the next? The second thing I would say, and I know these are more of conceptual concepts, is you've got to have a plan. I'm so glad you asked that question, because we don't want to find ourselves in these situations and then try to figure out what we're gonna do. Right. So as long as you've already pre-planned what you're gonna do in different situations. What am I gonna do if I'm out with my husband or my wife, and let's say the waiter brings a tray? How am I gonna think through that? What am I gonna do? You know, during the holidays, and everyone is different. You know, you asked a great question, but somebody may have a different. Like for example, as a doctor, we get a lot of free lunches sometimes, right?
Right.
So we've got to have a plan. We can make some suggestions to your audience today for that, but in general, I'd say put down what are the things that are going to be challenging you, and figure out a plan before you get there.
You know, I'm glad you said that, because I think one of the keys for me, and hopefully it'll help somebody, is I'm not a big sweet eater, but I do like ice cream. So I know at Thanksgiving, there's a spread of pies out on the table. One of the pies I love is banana cream pie.
Nice.
It's one of my favorites.
Right.
And so what I've chosen to do instead is I bring my own dessert.
Great.
So if I bring my own dessert, I ask whoever's home I'm going to for whatever the occasion is, whether it be Thanksgiving or Christmas or just somebody's having a party I'm going to, I ask if I can bring a dessert.
Great.
That way, if I bring my own dessert,
Great.
I don't feel like I'm being left out or cheated because I don't get any.
Great.
I still get dessert. And it's still healthy. And it's
Wonderful.
still going to fit within my carb intake for that meal.
That's great.
So I'm glad you brought that up, because I think
Absolutely.
everybody has to have their plan.
That's right.
And their own little idea of how they get through. Know what your weaknesses are.
Right.
And find the plan that's going to take care of those weaknesses.
Right on. You did it just right. I mean, it's either going to be take my own food, or it's going to be really eating less sugar.
Right.
You know? So, for example, you would have to, if you like the banana cream pie, you know, you're going to have to figure out, I'm allotted, for example, 50 grams of carbs, and how much is 50 grams of carbs. I mean,
Right.
it's one way or the other.
Right.
If you really want to do it just right.
Right.
Yeah.
Yeah, and that's exactly what I do.
Right.
And still try to stay within my calorie intake. So I kind of, especially if I'm going to family, I will get a menu, so to speak, of what they're having for going to be serving for that meal, and then I'm able to work my meal before I even get there. Work out my meal before I even get there, so I know what I can and can't have. And I do the same for a restaurant.
Right.
If I'm going out to eat, I'll go online. I'll see what their menu is and what their nutritional value is.
Right.
And that way I already know what I'm going to eat
Right.
prior to getting to that restaurant.
Right.
Saves the depression
Right.
and being upset because, what am I going to eat?
Right.
I already know
Right.
before I get there. And don't have them put bread on my table.
Right.
Because
Right.
I love bread.
Right.
So-
Great advice, and if I may add, even also if you're trying to lose weight, planning what you're gonna eat is great. So planning is great. For example, if you're trying to lose, say, 10 pounds, and you know your weakness is you go to the restaurant and you're gonna overeat. If you plan and say, look, I'm gonna have a chicken salad for the next week or whatnot, then you already have. You're not gonna struggle, like you
Right.
said, be tempted, be depressed, and be mopey about it.
Right.
Yeah, absolutely.
Right.
Sure.
I can't stress it enough, because it is what helps me.
Right.
And having those healthy foods in my home. For example, yesterday my husband and I were out, and I wanted Mexican food so bad.
Right.
And I let's go have it. And then before we got there, I kept thinking about all the healthy food I had in my house.
Right.
So no, let's just go home.
Oh, wow, that's
and
great.
went home and had a healthy sandwich for lunch instead.
Wonderful.
So it's just, like you said, you have to change your normal.
Right.
And my normal is to eat healthy.
That's right.
So-
That's right. You know, if you value your life, and if you want to live a long life and a healthy life, we've got to make those changes.
Right.
And I urge people to really. I mean, life is a gift.
It is.
God gave us this gift to do something worthwhile with it. With it. And I like seeing people healthy. But it's easy to preach. For me personally, I have my own struggles. I try to keep my weight down, but my weight keep wanting to go up. So it's easy to preach. We're all in this together.
Right.
Being a human is a struggle, right? In different ways.
Right.
But we want people to value their life. Family members value us. They want us to be healthy.
Right.
It's not even fair to them,
Right.
right? So I'm definitely on board with you there. Let's
Right.
make a plan and execute it.
Right. And know what your body does with certain carbs. Because I know for me, I can eat a little more potato than I can eat white bread.
Right.
And they both have carbs, but one spikes my sugar worse than the other does.
Absolutely.
So, and I think everybody's body's different like that. So
Right.
knowing your body and what spikes your blood sugar
Sure.
is really helpful.
Right.
And being able to keep your blood sugar under control.
Right on.
So, do you have anything else that you advice or anything else that you would like to add to today?
Yes, I would say you need to have a good doctor. And
Absolutely.
And what I mean by a good doctor, I don't mean a skilled doctor. You know, if you live in the United States, most doctors you're gonna go see are good in that sense. They're usually board certified and they know what they're doing. To me, a good doctor is someone that you can get along with. So someone that you feel comfortable talking to. You know, I like to joke around with my patients.
Right.
You know, not to be unprofessional,
Right.
but to connect. We're humans at the end of the day. And I want to
Yes.
be able to talk. You know, how can I sit down and give you advice and you share with me your struggles if we don't have that personal connection, right?
Right.
So find a doctor that you have that chemistry with. And if you go to a doctor that there's no chemistry, it's okay. You know, it's not his
Absolutely.
fault. It's not your fault. Go find another doctor. You know,
Right.
find that chemistry. Also find a doctor that is going to be that's gonna listen to you, right? So you don't want just that harmony. You want a doctor that that listens and is going to hear you and not just gonna kind of dictate to you what they think. And also that's also a personal type deal. I've had patients who, you know, I like to go to patients and say, look, this is what I recommend. What do you think? Because I want them to tell me. And some patients would look at me and say, what do you mean, what do you think? You're the doctor. And they would get mad at me, right? But I'm
Right.
trying to include them to be a
Right.
team. Some doctors you go to, they tell you, here's what you need to do. And some patients get offended. So it's really a match, right? So find that doctor that is going to listen to you, there's going to be that personal connection. And my advice is allow that doctor to see you often. A lot of times people come see me every 6 months, every 3 months, and they have a long list. It just won't work for us as doctors because I really want to take my time on each one. And the reality of medicine today, I can't be in the room for 1 hour.
Right.
Number one. Number two is, you know, the patient's not going to remember everything. So go see that doctor often and ask them, Doc, I want optimum health. How often do you want me to come see you?
Very good.
And make it open like
Right.
that, right? So obviously, you know, the doctor part is not everything, but it's good to have a doctor to hold you accountable, to give you advice, and to walk the journey with you.
Right.
Right. So if I were to give one other advice, that's what it would be.
I think it's excellent advice. Dr. Sadeh was my doctor when I was diagnosed, and you've been such a key in my life to get my diabetes under control. Knowing that when I would go to see you, and if I knew I hadn't ate right, or you know, I knew my numbers weren't going to be right, I didn't want to disappoint you.
Right.
And so the encouragement you gave me helped me down the path to be able to share that with others.
Right.
And so I absolutely agree with you about finding the right doctor, because you need somebody who's going to listen, somebody who's going to care. It's very important to me that my doctor hears what I have to say and what I'm going through, and not just already have a preconceived idea of what should be done.
Right.
And so I thank you for being the kind of doctor you are and caring about your patients the way that you do.
Thank you so much. And, you know, it's the same thing for me. You have been a great friend and a patient, and I think you've done really, really good. And what is most impressive about Cindy is she came to me one day and she said, I really want to share what I'm learning with others, you know, and I don't have too many patients that do that. And so you started this organization, and I just cannot be more proud of you.
Thank you.
I know diabetes is a great epidemic, and, you know, the numbers are looking like it's going to get worse and worse, unfortunately.
Yes.
So hopefully this message and your journey will reach thousands and millions. And I'm here to support your organization, Living Grand with Diabetes.
Thank you so much.
Absolutely.
I think at that that pretty much covers everything that I had for you today. And again, I can't thank you enough for taking
pleasure.
your time to come and talk to us and share your experience and expertise with us. It means a lot to me.
My pleasure.
Thank
Thank
you.
you.